I am Dr. Anil Peethambaran, Head of Neurosurgery, Medical College Trivandrum. Today, I will be talking to you about aneurysms of the brain. You must have all heard about aneurysms, which is something like a time bomb that is within the brain. Aneurysms are blood-filled sacs that is found on the walls of the blood vessels at the base of the brain. What happens is the constant flow of blood on the walls at the area where the blood vessels bifurcate or divide causes damage to the inner membrane of the blood vessel, and small outpouchings come out, and these outpouchings slowly enlarge with blood pressure and ultimately they rupture. As the rupture bleeds into the subarachnoid space of the brain, that is the area outside the brain. So this is called as a subarachnoid hemorrhage. Earlier in the 60s, it was believed to be a disease of the white people only. It was then in Dr. Sambasivan, the head of neurosurgery in medical college in those days, he found out, he investigated all patients with severe headache suspected to have subarachnoid hemorrhage with a carotid angiogram, and he found that these people are harboring aneurysms also. So he presented this in the World Congress and it was well appreciated. People were surprised that in a small part called Kerala in India also had aneurysms which are common with the white people. So that is how the neurovascular surgery started in India, first in Trivandrum Medical College. So coming to the symptoms of subarachnoid hemorrhage, the patient will experience a sudden onset of severe headache, a headache out of the blue, or otherwise called as a thunderclap headache. It's a kind of headache the patient has never experienced before. It's so devastating. So it may be associated with loss of consciousness. Sometimes it can be associated with vomiting, and sometimes patients have sensitivity to light called photophobia. Patient will have difficulty in looking into the light, and sometimes the patient even may have weakness of one side or difficulty in opening the eyes or blurring of vision, and even they can throw seizures at sometimes. Nobody knows only why certain kind of people are prone for this kind of disease, but it is commonly seen to run in certain kind of families. Sometimes it's seen often in people who smoke a lot, also in drug addicts and people with uncontrolled hypertension, and also people having some inflammatory diseases of the blood vessels and infections of the heart. So what happens when this severe headache occurs? The patient will feel a devastating headache. Then this patient is taken to the hospital and an immediate CT scan is taken. So this CT scan will help you reveal that there's blood inside the brain. It's otherwise called as a subarachnoid hemorrhage. So immediately the patient has to be transferred to a neurosurgical center. The neurosurgeon will see this patient, and according to the condition of the patient will decide whether he should send the patient for an angiogram or nurse the patient in the ICU till the patient becomes stable. If the patient is fully conscious, then patient can be taken for an angiogram called CT angiogram or a 4-vessel angiogram called DSA. So this will help you show where the aneurysm is harbored inside the brain. So depending on the location of the aneurysm, that part of the brain is opened. The patient is given anesthesia and the skull is open and the brain is dissected till you reach the area where the aneurysm is harbored. Then you dissect the aneurysm and put a clip around the neck. So till then the patient is not secured. So once the clip is applied, then the patient can be called secured. But there's one more problem is these vessels can later go into spasm and can cause diminished blood supply to certain areas of the brain. That's called vasospasm. This is mainly due to the blood surrounding the blood vessels irritating the blood vessel walls, causing it to shrink. So this can be avoided to a certain extent by washing off the blood during surgery and putting in a small drug called papaverine onto the blood vessels, which will prevent the vasospasm. So this has the advantage of ensuring 100% clipping under vision and washing of the blood around the blood vessels to prevent vasospasm. There is another kind of treatment called as embolization or called coil embolization. This is done without the help of an operation. The neurosurgeon sometimes will decide to send the patient for this kind of treatment when he finds that the aneurysms are found in a difficult to operate location like the posterior circulation. So these patients are sent to an interventionist that could be a neurosurgeon or a radiologist. So they pass a small wire through one of the major vessels of the limbs, upper limb or lower limb, and through this wire they pass small coils which are embedded into the saccular projections called aneurysms. So these coils will obliterate the aneurysm. Later they get thrombose and they prevent rupture. So this is another mode of treatment for aneurysms. So Either way, you can treat the aneurysms depending on the center you are being referred to. If you have a very good interventionist, then you can go in for coiling. If you have a very good neurosurgeon, then you can go for clipping. But clipping is always 100%. You can ensure that the clip is applied at the neck of the aneurysm. Proper clipping will ensure that the patient, the recurrence rate is very minimum. At the same time, coiling may not have 100% occlusion sometimes. So there's a good chance of recurrence. So these patients undergoing coiling should have a repeat angiogram done every year for at least 2 or 3 years. So either way, the treatment is secure. So the most important thing, you have to take the patient to the hospital as early as possible. Now, I wish to thank the Swasthi Foundation for starting such a beautiful program where you can bring out medical information and the knowledge can be dispersed to common people. We all know that they are doing such a lot of service to cancer patients, and it is now not only known inside the country, but it's known outside the country also. This is actually a great thing the Swasthi is doing, and I congratulate them and I wish them all success in future. Thank you.